A very good evening to all dear participants. Am I audible? Thank you very much. A warm welcome and very good evening to all dear participants. A resource person of today's session, respected Dr. Punit Ohri sir, and chairperson of today's session, our respected Dr. Atul Juneja sir. I again welcome to all of dignitaries and all the participants presented in today's session. Now, I would like to introduce today's resource person of the session, Dr. Punit Ohri sir. Sir is currently working as a professor and head department of community medicine and SGRR, Institute of Medical and Health Sciences, Dehradun. Sir is WHO NP 7 years and faculty in SGRR, Institute of Medical and Health Sciences, Dehradun, 11 years. Presently HOD and MEU coordinator and a member secretary various committees. A member of IAPSM, IPHA, CARCOM, APCRI, IMA, and state health committees. Sir is as a former executive member in IAPSM UP UK chapter and also member of National Editorial Board of Indian Journal of Forensic and Community Medicine Journal. Sir has published 14 publications in international and national journals. Now, I would like to invite sir to kindly lead today's session. Please, sir, welcome, sir. Very good evening, sir. Dr. Atul Juneja is with us. Very good evening, sir.
Good evening. Good evening. Thank you so much for making me part of this important activity.
Yes, sir. With your permission, I would like to request to our resource person, Dr. Punit Ohri sir, to kindly lead today's session.
Sure. Please go ahead.
Okay, sir. Sir, Dr. Punit sir, please unmute yourself. I'm not getting any voice, sir. Please. PPTs are visible, sir.
Is it audible? Is
Yes,
it audible now?
Yes, sir.
Yeah, yes.
Please, sir. Welcome, sir.
Yeah, just a second, because there is some echo.
Okay, sir. No problem, sir.
Okay, my topic which was given to me was how to write an effective conclusion in the thesis. Is there an echo on your side?
Pardon, sir?
Is there an echo on your side also?
There is a little bit echo, but it's okay.
Okay.
I think it's fine.
It's fine here too.
Yes, sir. Please, sir. Proceed. It's fine, sir. And try to make PPTs in slideshow mode so it's get a larger view to our participants. Yes, sir. The bottom sign. Make it in slideshow mode. After notes in the bottom, fourth icon is a shortcut, sir.
Yeah, I'm trying, but I think there is some glitch.
Oh, in that case, sir, if any issue, I think some overlapping windows are appearing.
Yeah,
So,
that's what I'm trying to sort it out.
so stop sharing and again share. So I think the issue will be resolved automatically.
Okay. Okay. Once we say we are reaching to that situation when we have done our thesis and conclusion has to be written in the
Sir, can't we have on the presentation mode? This is an edit mode, what we are looking at actually.
Uh,
Oh,
yes, sir,
yeah,
yes, sir, from
that's
here.
great. Yeah.
is
Yeah,
it better
perfect.
now?
Yes, sir,
Perfect.
perfect, sir, perfect, sir.
It's
Thank
perfect,
you
sir.
very much.
Okay, once we start with our thesis writing, then we have is that a challenge is how to write an introduction. So once we are talking about introduction, your task was to move from the main or the journal content to the specific of your research question or the research problem. So say you have a question or a topic which has been chosen is that what is the prevalence of diabetes in adolescent? So once we are talking about this, and we are talking about in general, what is the uh, topic and what is the adolescent, how the general patients are having or the adolescent are having this diabetes or not. So once we are talking to our subject specific, can I see how can I reduce my echo? It is pretty irritating for me. Can you help?
Sir, you are getting your voice.
Yeah.
Okay. Sir, logging from any other devices, using only
Oh,
one device or any two devices?
I'm logging from one device only.
And any other device where you are watching the same session?
No, but the voice is echo.
Sir, echo is depend on the location only.
Uh,
Space
Anyways, once we come from introduction to through the title, aims, objective, then we go to
at the
top.
at the sir at the bottom and where we can mute and unmute myself. There is one option and at there one is a arrow. After mute there is an arrow. No, not here,
Mhm.
sir. Not here, sir. In the Cisco WebEx.
Hello.
Yes, sir. Yes, sir. At our end, the voice is fine, sir.
Yeah, but I have a issue with me. I mean, there is a lot of echo, so I cannot. Sh-
Uh, in that case, sir, there is an option for noise removal. In the bottom side, next to mute, there is an arrow. When we click on that, then there is an option of noise removal. Or any other electronic devices are presented near you, then please make some distance from that.
Hello, am I audible? Hello.
Yes, sir. Yes,
Yes,
sir.
yes,
Okay,
you are
fine.
audible.
Now it is better. So
Okay.
we were talking about how we have to go for conclusions. Sorry for the inconvenience. I was talking about that once we were writing the introduction of the thesis, your task was to move from the journal to the specific. That is from the topic what we're talking about, and now we have to go down to the research problem, from the field study to the field of study to the research problem. However, in the conclusion, your task is to move from a specific discussion, your research problem, back to a general discussion. That is how your research contributes new understanding or fills an important gap in the literature. As I've taken one example, if you remember, I talked about that was talking about the diabetes in adolescents. So the what would the research problem? The research problem would be this question, and how your research contributes to new understanding or fills an important gap. Like, for example, in this situation, if we see that now we have a cases of diabetes in a population of even under say 15 to 19. So that means there are some new case, new reasons of why the diabetes has come down to this. So if we are doing our research study on something which helps us to find out something which is newer, what is our this investigation or whatever the research question has contributed to our already understanding. So that will be important once we are talking about the conclusion, which we come down from our research question to our methodology, coming back to the process of data analysis, and then we come to that conclusion. So this is one perspective once we are talking about the conclusion and how to write an effective conclusion. We don't have to write elaboratively on this component. So what are the main elements of the conclusion in the so what are the main elements of conclusion in the thesis? It is an integration of the study, what we had found in our study, what are the analysis which have been done during our study, and how we interpret and how we synthesize. So taking all these four components, we come to the conclusion of the study. As is, for example, which we have taken about the diabetes in adolescents. What are the findings? What were the previous findings? What are the analysis what we have done? Is it going to be more seen in our younger age group of the data which were taking from the specific area compared to other areas, or we are talking about something which is specific to a population of a younger age group, which may vary from 10 to 19, but at the same time at among these subgroups where the data shows that there is a trend of diabetes increasing. What is the interpretation of this, and how we are going to project it further? That would be another part. Like if we have a increase of a particular disease in a particular age groups, then how we are going to use this information and synthesize this information for a good conclusion of our research work. So, as the concept has been formulated and informed to you, so what we say is conclusion is concluding statements and the thesis with strong, clear, concise take home messages for the reader. So the conclusion shouldn't be running into the pages. It should be small, crisp, and telling about what are the key points of your the research questions, whatever the analysis have come down from that. What is there clearly being said by that? What are the strong messages which are being given by your study? And it should be very concise. Conclusions are not the same as findings. Neither are conclusions the same as interpretation. Sometimes the people write that again the similar, like say there is a 3% in of cases of diabetes seen in under 15, and then there are 7% of the cases seen in the diabetes in say from 16 onwards to 19 years. So that is not the conclusion. That is what is your findings. That is your observations. So then you have to find out what you have to not do right in the conclusions. So these are neither our conclusions, and they are not. They are the same as interpretations also. So rather, conclusions are essentially conclusive statements of what you know, like what we have come to know, that this is increasing or decreasing in a particular age group, the disease or intervention of some drug intervention. Suppose we are from the background of say Dravigun, or we are from the background of Rasshastra, or from other departments where we are using these drugs interventions. So in that case also, we don't have to present the data again. We have to tell that this is going to improvise or further enhance the cure of the disease. So these are essentially conclusive statements of what you know, having done this research that you did not know before. So this is very clearly that if we do some intervention, then what is going to be happening for the intervention by this particular drug. Similarly, for any prevalence or newer disease, you have to find out some incidence. Then we have to see how this disease is going to behave in coming times. So conclusion must be logically tied to one another. There should be consistency among your conclusions. None of them should be at odds with any of the others. So it should be clear and very rational once we are talking about the conclusion in subsequent paragraphs also. So what are the problems which we have to avoid in the conclusion? Do not simply reiterate your results or discussion of your results. As I've already said, we are trying to re-emphasize on that point. Don't use opaque and complex languages. It should be very clear, simple language. Failure to be concise should be there. Should be a challenge. So we should be always be to doing something which is very concise. There should be not failure to reveal problems and negative results. We should be able to identify if there is some which I mean, sometimes people say that my study was anticipating this result. If the results are not coming as be expectation, we should not be shying out that the results are in a particular age group or a particular time, place, and person. The data or my study is not revealing something which is expected. If it is that, we should be able to even demonstrate, or even we should be able to write in conclusion that this has shown the negative results. Failure to provide a clear summary of what was learned, that shouldn't be there. That we are not very clear about what our further whatever our analysis have come out, and we still are not sure about what we are going to write as a summary. That shouldn't be a failure on that. Failure to match the objectives of your research. So what were our objectives? If you remember, somebody must have told you in the beginning also, that if there is an aim and objective, aim is probably a one single core. When we are talking objectives, there may be multiple objectives to find out the various components of the aim. So once we are talking about conclusion, we should be seeing that all the objectives of our research have been addressed once we are talking about the conclusion. So that's all from my end. Over to you, Amit.
Thank you very much, sir, for this whole session. And I would like to invite participant to, if there is any query regarding today's session, then please raise your hand or write your query in the chat box. I again request to all participants. This is a small topic in the whole session, so it's completed in early time. If there is any query regarding today's session, then please raise your hand or write your query in the chat box. I'm just waiting for your queries regarding today's session. Tomorrow we move on how to write recommendation and limitation of a study. So before that, it's necessary to know that how to write effective conclusion writing. If there is any query, then please write your query in the chat box. Okay, great query. Sir, there is a query in the chat box from Dr. Nitesh Joshi. What should be word limitation limit for writing conclusion?
There is no limitation. Am I audible?
Yes, sir.
Yes,
Yes,
yes.
sir. Audible.
Yeah, there is no limitation for writing conclusion. The only thing is it should be very crisp, precise. I mean, it shouldn't be running into pages. Conclusion can be say half page. That's what I can say. That but if it is not being justified in a half page, you can increase the say the number of words. But it shouldn't be very big so that a person doesn't understand from your conclusion that the matter has not been conveyed by us writing it too small or too big. So there is no hard and fast number of words or number of pages for conclusion. It should be very precise. That's what we had already said in this one
Thank
slide.
you, sir.
Any other questions? I think there was somebody else also who was asking some question.
Yes, yes.
Do we
Doctor,
need to avoid statistical calculations? Yes. There is another question which I could read out. There was some question that should we be not be writing the statistical data in that. I think I have already said that we should not be writing again and again. We have already said that if you have already written in your analysis and discussion, we need not be writing again the data in at large for that reason. Any other question? Exam center. Can you see any question in
Doctor,
chat box?
Dr. Anup, is there any query?
Can you see the chat box? I could see one of just floating up and popping up.
Yes, yes, sir. I'm just letting. Dr. Anup written that do we need to avoid statistical calculation in conclusion?
Yes, sir. And do we need to avoid it completely if it have any significance? If it is in actually, if my study is just about 0.05, p-value is just 0.05, do I need to mention it in
No,
conclusion
no,
also?
no, no.
Okay, thanks.
Dr. Pavle, Dr. Pavle, please unmute yourself.
स्कोप ऑफ फर्दर स्टडी ये कंक्लूजन हेड में ही लिखना है क्या?
That is recommendations. That is another topic which we say conclusion में नहीं लिखना होता उसमें recommendations हम कहते हैं recommendations. What are your recommendations once you have gone to the study? You have something coming up that which is a policy level decision to be taken so that we can recommend it to the state or to the government of India or whatever, I mean, what level we are talking about. If it is a technically something coming out as an intervention, you can write as a recommendation which can be further forwarded by your organization to the higher organizations which can take a research further in a higher level. So that are recommendations what I think you are talking about. If I'm clear, I hope you have been able to answer your question.
Yes, Dr. Priyanka. Dr. Priyanka, please.
Yes, sir. I was asked the same question that do we need to write the further study that can be done? That was the earlier question also.
Yeah, I just responded to that.
I just
Conclusion
answered,
is
yes.
conclusion. जो
Thank
आपने
you.
काम किया उसके बारे में बात करता है. Recommendation is something which has come as a novel thing, or you think that there is something which is coming as a follow-up or a byproduct of your study, whatever. So that you can write as a recommendations.
When we go for the pharmaceutical study, we go for analytical, antimicrobial, or cell line studies. Then
Yeah.
we come to the conclusion that that this study can be taken to the further stage after performing animal study or clinical trials. So, do we have to write those things also in the conclusion? Actually,
Recommendations.
okay. Okay. Thank you so much.
Thank you, ma'am. Thank you very much, sir. all participants get benefited from today's session. I think all queries are answered. If there is any remaining query, then please write your query or send your query in the given mail ID I have shared in the chat box, ayurveda.is@gmail.com. Please send your query. And again, thank you, sir, for making session very interactive and very interactive discussion around query session.
I
Now,
hope that the message is very clear. The conclusion is not to be going to be very big one. It has to be having a clear, short message, sweet message, which is a take-home message. And there is nothing which is a follow, which whatever you are talking about is what further you want to do. That is on the part of the recommendation. I hope that this message is very clear. So that is why I've kept very small, little number of slides so that at least the message is clear for the conclusion.
right, sir, definitely, sir. I hope that our participants definitely get benefited and from today's session. Now, I would like to introduce today's chairperson of the session, Dr. Atul Juneja, sir. Sir is a former scientist chef and coordinator clinical trials registry India, CTRI, ICMR National Institute of Medical Statistics, New Delhi. Sir is currently working as a guest faculty at AU Tibbia College, Government of NCT Delhi for research methodology and visiting consultant of biostatics at PSRI Hospital, New Delhi. Sir is also visiting faculty at Nehru Homeopathic College and Hospital, New Delhi. Sir is presently member of various scientific committees like member of National Advisory Board of Journal of Case Reports published by All India Institute of Ayurveda and member of Scientific Advisory Committee Clinical Research for Central Council of Research in Ayurvedic Sciences CCRAS, New Delhi. Sir is a member of DNB Committee for Jaipur Golden Hospital, PSRI Hospital, Mamta Chanan Devi Hospital, New Delhi, National Heart Institute, New Delhi, and a member of DSMB of Central Council of Research in Ayurveda, CCRS, New Delhi. Before that, sir is nominated as a representative of ICMR for expert committee member of Central Pollution Control Board and nominated by the director NIMS NIMS as a member of MST of Bureau of Indian Standard and had been member of the DNB committee of BL Kapoor Memorial Hospital, New Delhi. Sir, also nominated for the paper setting panel for Central Council of Research in Homeopathy for the selection of the post of statistical assistant and chaired the selection committee for the post of SRF in statics at Central Council for Research in Homeopathy. Sir has delivered more than 60 lectures or served as a panelist for the various capacity building programs conducted by ICMR, DHR, NIPCCD, Central Statistical Organization, RML Hospital, PGI Chandigarh, Government Medical College Chandigarh, Rajasthan University of Health Sciences, Jaipur University, MD University, Rohtak, CCRS, and Jamia Hamdard University, New Delhi during last 10 years. Sir is a member of National Academy of Medical Sciences and a life member of Indian Society for Information Theory and Application. And Sir is also a life member of Indian Association for Population Sciences and had been an annual member of Indian Association for Cancer Research. Sir has published more than 60 publications to credit with 25 as a first author and attended more than 70 national and international conferences, including invited talks. International participation include countries USA, Canada, Singapore, China, and Malaysia, etc. Now it's our privilege to invite you, sir, to kindly share some views and kindly sum up today's session. Please, sir, welcome, sir.
Thank you so much, Professor Tiwari. It has been a pleasure and honor to be part of this program as chair, and it was very nice to hear Dr. Punit Ohri. And as I know that, based on my interaction, he is a very knowledgeable and a very diversified, with person with a diversified experience. And although it was, as he mentioned, that it was a small presentation, but it had a very big message, because as based on our experience, and perhaps Dr. Ohri would also agree that when these, particularly the students at a younger level, they go for thesis writing or paper writing, they tend to mess up at the conclusions, because as he clearly mentioned that it should not include the results. But most of the time what we have observed that the students or younger researchers start writing the results in the conclusion. So that was a very strong message and a very simple and a clear way. And really, I must honestly say that not as a chair, I enjoyed as a participant more his presentation. And I always feel that hearing from such people with that experience, it's always a learning at every stage. Thank you so much, Professor Ohri. And it was really nice hearing you, and look forward to more interactions with you.
Sure, sir. Sure,
This
sir.
group is honored to have you. Thank you so much. Thanks organizers for making me part of this program. As I mentioned, it was a pleasure listening to him, as usual. Thank you so much.
Thank you, sir.
Thank you very much, sir, for your kind words, and
Thanks.
thank you again for your presence. It's our honor to be to great personality at the same platform, Dr. Atul Kumar Juneja sir and Dr. Punit Ohri sir. Thank you very much. Thank you again. Now, on the basis of Institute of Applied Statistics, we convey our sincere thanks to all the participants for their active participation in today's session. I heartily thanks to our resource person, Dr. Punit Ohri sir, for their interactive session and to the point describing the whole session. Because the session is the topic is very small, but sir described very well to the point. So it the participant exactly get in a short time of period what is actually conclusion, how to write that. And I again hearty thanks to Dr. Atul Juneja sir for your kind words and your presence in today's session and sharing today's session. I again thanks to all the participants. Tomorrow we have one more session presented by Dr. Hitesh Khurana sir from PGI Rohtak, Haryana. He will deliver lecture on how to write recommendation and limitation of a study. So please join at 6 p.m. as the same time. If there is some changement of time, then I will let you know through the groups. Thank you very again. This is the end of today's session. I again thanks to our resource person and our chairperson, sir. Thank you for your presence. Thank you very much.
Thank you, sir. Thank you.
Thank you very much.
Thank you, Dr. Juneja.
Thank you so much, sir.
Thank you, sir.
Thanks.